and this situation now is so much worse. We're asking our politicians today to invest in the public health system, invest in nurses and midwives, invest in ratios.
Today, thousands of nurses from across Sydney and the state declared enough is enough.
Going ahead, despite an 11th hour ruling from the Industrial Relations Commission.
We've got thousands of nurses here, but right across New South Wales, there's about 30 other rallies taking place.
Patients aren't safe, and we've been saying this for way too long, and they are not listening to us. So now it's time for action.
Patient safety is bad, skill mix is bad, people are burnt out, we need more staff.
We are exhausted. We are being asked to do overtime every shift, every day. And some nurses are working up to 17, 20 hours in one go. It's not on.
So much worse now with COVID, dealing with incredibly sick patients and also huge amounts of stress that we've never dealt with before.
The only reason we've gotten through these last 2 years is because of your hard work and steadfast commitment to your patients.
It'd be a different story if it was the politicians. So come on, shape up.
Because we're not coping, that's the truth. But the problem is this government saying we're coping, so our community doesn't know where to stand. They don't know what to expect. And then they go to emergency and they wait for 2-3 hours, sometimes 6 hours. That's not right, it's not safe.
Well beyond breaking point. It's not like it's breaking, it's done.
Walking into a waiting room full of people and telling them, I'm sorry, we have no nurses or doctors tonight. There's a 10-hour wait. Go home or wait till the morning. Is that a world-class health system? We are nursing patients out in car parks.
It's absolute chaos. We had one instance where there were 28 COVID patients on the ward. There was one RN, 2 ENs and an AIN to care for them.
Staff are leaving because it's less strain and stress to pack shelves with better pay, which is leaving us running on a very thin line.
In ICU, we lost 11 full-time positions in just a couple of months.
It's atrocious. Assaults and aggression has increased dramatically. We're hemorrhaging nurses. People don't want to stay anymore.
We have to look after 50 patients in the waiting room for just 2 people. That's really unsafe. And these are children.
We're not coping, so they need to wake up.
Midwives are unable to provide the bare minimum standard of care that our women and babies deserve. Babies aren't counted in our staffing numbers.
We need nurse-to-patient ratios on every shift. Don't just count the number of patients at midnight.
Not only do you deserve to go to work, have the right number of nurses and midwives to look after the numbers of patients, but you deserve a pay rise as well.
Extra money, extra nurses. Give us our ratios and stop the lying.
Minister, ratios, while saving lives, decreasing morbidity and mortality, reduce the health budget. Our members will not be lectured about safe staffing by these men!
Stop saying no and let's say, yes, we'll fix it.
We know that ratios can help staff our wards and provide the best possible care that our consumers and our patients deserve. Enough with the platitudes. Stop gaslighting us.
It's time for the Premier to listen. Implement ratios. Give us a pay rise that recognises what we have sacrificed and repeal the damaging workers' comp amendments.
And we'll do this as often as we need to do until the government actually listens to you.
But until then, we're here for the long fight.
What do you want? When do you want them? What do you want? When do you want them?